but give you more free time. And so you want to think about which type of those jobs you want if you have interests outside of clinical care.
Yeah, that's interesting. It's a piece of advice that all of us should take, that you guys, one should explore other interests as well besides just doing medicine and the clinical practice. Yeah.
Right.
So thank you so much. So my next question is pretty much the follow-up to that. Now, if you are a medical student, like if you're someone who's preparing for the boards, if you're preparing for this step one, how would you personally use your own resource, boards and beyond, alongside all of the other necessary resources such as UWorld, such as Pathoma, such as Sketchy?
So when I prepared for the boards, this was in the late 1990s, I used first aid as my guide. I found first aid for the boards to be so helpful because it's very specific on what you need to know. And I don't know anywhere else you can get such specific information of what you need to know. The problem was back then, the only resource I had to learn those topics in first aid were textbooks. And if you've ever tried to learn directly from a textbook, it can be hard. They're very dense. You don't have any ability to practice. So I created Boards and Beyond as the type of resource I would have wanted when I was a student. I would have wanted someone to, in plain English, explain the concepts in first aid for me, not at a really high level like an expert would know because I wasn't ready for that, but at a basic level that matched what students needed to know for step one. And so that's how I made Boards and Beyond. So personally, if it was me studying, I would use Boards and Beyond to understand first aid. And then I would just do questions. I thrived when there were practice questions. And it was really hard for me in medical school because we didn't have access to practice questions like you guys do now. There were very few, there were no Q banks. There were a few books, but they weren't very good. But if I were a med student now, I would use Boards and Beyond, make sure I understood everything in first aid, and then I would do as millions of practice questions, from every Q bank I could get my hands on.
Yeah, like first aid is sort of like the Bible, you can say, for studying for step. And I think the idea behind Boards and Beyonds was like that it acts as a sort of supplement to understanding first aid better. Like that's the whole idea behind Boards and Beyond, if I'm getting it right.
No, exactly right. I took each topic and I said, what does a med student need to know? Not what does a practicing doctor need to know? That's much more advanced. And that's what I think sometimes frustrates students when their teachers talk at too high a level. I tried to really understand your level and give you 15, 20, 30 minutes. And when you're done with this, you'll understand whatever, adrenal insufficiency or heart failure or lymphoma, just give it to you straightforward.
Yeah. So yeah, that's a good thing. Like that's a real insight into the idea of making Boards and Beyond. Rubab, could you take over and then let's talk about med school residency?
Hi, Rubab.
Hi, can you hear me?
Yes.
Okay, so first of all, I can't still believe that we're here and we're speaking to you, because I feel like just a couple hours ago I was just sitting and I was watching Boards and Beyond videos, even today. So I'm just taking my time to just realize that it's actually real. So thank you so much for being here with us today.
You're welcome.
And like Karthik said, I am Rabab and I'm the vice president of CIG. So Karthik has asked, really interesting questions. And I do have this one question, how medical students, they feel like, during their clinical rotations, they just go and whatever they're doing, they just seem to really like that, so how can we determine that, what specialty is the best fit?
Yeah, that's a very good question. The best thing I can tell you is, having advised a lot of students for a long time, at some point, the vast majority of students just know. It can be a different reason for everybody, but you start to see yourself in the shoes of a person in that specialty. So you see yourself doing what a surgeon does every day or doing what a radiologist does every day, and it just feels right. The other thing too is the people in each specialty do sort of have a personality. Surgeons are a little bit more hurried and straight to the point, and pediatricians, it's not as bad as the caricatures are, but, pediatricians tend to be a little bit more sensitive and touchy-feely and things like that. And radiologists are techie sort of people who like computer images and data and things. So you'll see that you just sort of feel comfortable in a certain group. And that goes a long way too. When I spent time with the cardiology fellows, I really liked the way they thought. It reminded me of myself, and I could picture myself sort of having them as my colleagues, and it just felt like the right fit. So There's no perfect recipe for how to find the right specialty, except to just bounce around as much as you can, get the sense of the personality of the specialty, and try to picture yourselves in the shoes of the attending. Eventually, you usually will have a moment where you just go, aha, it feels right.
Okay, so that's actually right. Like you're saying that,
makes a lot of sense.
Just keep trying and see, what you like best. So now, why exactly is it that you feel like cardiology often is a popular choice among medical students? Like, they really seem to like it more than other specialties at time. And what personally drew you to this specialty? And now that, you're a practicing cardiologist, do you feel that, this aligns with your professional aspirations and personal fulfillment?
Yeah, I liked cardiology because it had a mix of old-fashioned medicine where you take a history, you do a physical exam, you have long relationships with your patients, but then it had a lot of new-fashioned medicine, like high-tech things like echocardiograms and ultrasounds. So I really liked that mix of traditional medicine with high-tech medicine. I also liked being a specialist, and this is also part of the personality. I was never that interested in primary care, emergency medicine. They're great fields, but I didn't like I wanted to be the end of the line, the person people come to. I was very comfortable taking care of high stakes situations. I wasn't, afraid of someone who has a serious heart condition. I was wanted to help people like that. So the fact that it was a specialty where the stakes were high and had a lot of technology plus long-term relationships for patients, it just felt like a really good mix for me. Again, though, everybody's different. There are people who see cardiology and say, oh my God, I never want to do that. It's too narrow or, too techie or so there's you will find something out about yourself as you go through these specialties and you see which one is best for you.
Perfect. Thank you so much for sharing your insights about all of that.
So Dr. Ryan, so like my question would be, so because like obviously we're cardiology interest groups, so I mean, it tells a lot that we do want to become cardiologists. So what would, like, you can say the guidance or a piece of advice that you would offer to someone who's aspiring to be a cardiologist?
Yeah, so I've worked with a lot of cardiology fellows and attendings from Pakistan and other IMGs. So the first thing you should know is that it's a very reasonable path. It's a very achievable path. The good news about cardiology is there are a lot of training programs. Okay, it's different from like dermatology, where there's a very, very tiny number of training programs, and it's hard for anyone to break in. But in cardiology, there's lots of opportunities. So the first piece of advice I have is to get into a good medicine program, and the best way to do that is to see where people in your school have gone before. That's really, people don't think of this, but your greatest asset in your application is the people that have gone before you from your school. A medicine program that has taken 1 or 2 or 3 people every year or 2 from your school and they've been successful, they're going to trust your school as a training grounds. And so they're going to want to take you. So try to find out where other people have gone, try to follow in their footsteps, or at least find other programs that have been friendly to other IMGs, and are welcoming to that group. Then once you get into residency, the best thing you can do, believe it or not, is to not focus too much on cardiology. You want to just be a terrific intern in everything you do. Get good evaluations from the ICU, good evaluations from the hospital wards, good evaluations from the ER. These things will, become part of your program director's evaluation of you. And that's what usually leads to a fellowship. It's good if you can do some research, it's good if you get to know a cardiologist or 2, but I would say the far more important thing is you just want to be the best medicine intern or resident you can be. And those people usually match. Sometimes they have to apply broadly, sometimes it's not their first choice necessarily, it's their second or third, but usually if you've gone to a good medicine program and you've performed well, your odds will be good for getting into a cardiology fellowship.
Right. So Dr. Ryan, so with roles spanning from cardiologist to an educator to researcher, how do you effectively prioritize and manage your diverse professional and personal responsibilities? Like, what advice would you give to someone who has to look a young aspiring physician who has to juggle between all these sort of different roles?
Yeah, it's not easy. I have one of these brains where I'm always thinking and spinning. It's sometimes a bad thing. I drive myself crazy. But, so I was always thinking about things like boards and beyond and other things as I did other work. But, you know, like I said, a big factor for me was that first job out of fellowship. You know, what's that job going to look like? Are you going to be working your nose to the bone from 7 to 7 every day without a free moment even to have lunch, but you get a big salary? Or are you going to make a smaller salary, but you have a little bit more comfortable lifestyle and living? And this opens the door for you to explore side interests and things like that. I think that's what made me able to think about something like Boards and Beyond. You know, also I was a teacher. I was at a medical institution, so had opportunities to teach and hear from students like the one who showed me Pathoma. You know, that might never happen if I was in private practice, not teaching any medical students.
Like, did ever sort of like you think that it might be too much, like making the whole BNB videos, like because it was, you can say, a side thing to your main career. So did you ever thought about like, you know, that it's too draining or too time consuming or something like that?
There were moments along the way. It is funny how it happened though, because I initially made the website with only cardiology videos. It started with just 44 videos. And there were times where I thought about just stopping, but the students kept using the website and kept emailing me saying, can you do more? Can you do more? And the more I looked into what was out there, I saw an opening. You know, even though YouTube has videos on everything, a lot of them are not that good. They don't meet the needs of a student preparing for step one. So I thought, you know, even though I may not be an expert in cell biology or biochemistry, you know, I know enough about these things and I have colleagues in those areas who can help me make the slides. And I just sort of, I got like addicted to it. It was like a bug. I kept wanting to make more and more videos, and it's kind of a nerdy thing, but I kind of had fun to go back, you know, because when I learned those topics like you, my head was spinning. I was very confused. But when you can go back 10 years later or 15 years later as an attending and you've seen a lot of things, you see where these things fit in. You know, you see why certain things in biochemistry, where they come up clinically. And you'll probably see that in my videos. I always try to mention if there's a clinical reason to know something. And it was really fun to see that, say, oh, this is why we order the ANA all the time when we suspect lupus. And this is what ANA is, you know. So it actually became kind of fun for me whenever I could carve out time to make a new set of slides and record a new video.
And it's a really satisfying feeling when you're linking the stuff and it all comes together. You're like, oh yeah, that's what's happening. It's really satisfying. Yeah,
exactly.
Okay. So Dr. Ryan, just a question. As you mentioned that initially there were just cardiology videos on your website. So it's just a personal question that being a cardiologist, do you think that when making the entire Boards and Beyond video series, there was this personal inclination more towards giving knowledge, like particularly talking in extra detail when you're making the cardiology videos? Because a lot of times you said that in my field of cardiology, you used to give just clinical correlations, and that was very exciting. Now that this was something that really, you know, kind of motivated me as well, because again, I'm aspiring cardiologist since very start, so that was very motivating. So was there a personal biasness or inclination?
Yes, no, I mean, I love teaching cardiology because I had so many stories. I did have to rein myself in, because I would sometimes fall in the trap that many other of your teachers fall in, of talking way over I mean, I could tell you stories of patients with myocardial infarction who presented with ear pain or headache, but you're never going to see any of those things on step one. And it's hard to appreciate those until you've been out there. So I had to cut myself off and say, just stick to, you know, the basics. You know, occasionally I throw in something I've seen clinically if I think it's a relevant detail, but I had to watch myself in cardiology and other areas too, where I'd seen interesting cases, to not go off on a tangent and talk about something that's really not relevant. Because I think that's part of the problem, is most medical students are taught by high-level physicians, and it's easy to start talking about, you know, bone marrow transplant before you've even defined what a lymphoma is in the first place for the students, for example.
Yeah. Okay, so Dr. Ryan, a lot of students ask this question about, so like before that, I think all three of us follow you on Twitter, and like I'm more familiar with using the term Twitter, although it's called X right now, but yeah, Twitter. So I think we're very familiar with your views on the whole culture behind having lots of publications and like going nosediving into research. So like there's this increased emphasis on the publish or perish research culture. So what are your thoughts on current? Yeah, you're new to Twitter. So guys, please follow Dr. Ryan's new Twitter.
His previous account was hacked. So guys, please go and follow.
Yeah. So what are your thoughts on this? Yeah.
Go ahead.
Yes, sir, you can go on. Okay. So what are your thoughts on the current state of research culture and this competitiveness in that everybody's trying to get like tons of research? I personally know med students in my grade who are like 20, 30 publications. So what's your thought about on that, now the whole research culture?
I mean, I think this is really bad that we're emphasizing research volume over quality.
Yeah.
And I think it's really bad that research has become a must instead of an optional thing. If research is important, and if you're really interested in research, by all means, you should go and do it. But, what I see is students getting filtered out when they apply if they don't have a minimum number of publications. And I think that's a real shame. It's actually turning people against research because they feel it's something they have to do, even if they don't want to. It feels forced upon them. And, I hope something will change in the future. Maybe there'll be a cap on the number of research citations you can have when you submit or something like this, or maybe just the program directors will start to become, weary of it and not always make this such a priority. But unfortunately, I think you do need to have some research for competitive programs. That's just the reality. I hope that changes someday because I think overall it's just not good. It's not good for you. It stresses you out to have to do research on top of everything else.
Yeah.
And I don't think it generates a lot of research scientists, and some of the publications are of low quality. So it's just all around not a positive thing for the medical field that we emphasize, any publication is good.
Okay, so but since as IMGs we have to make sure that our CV stands out and everything. So like if not research, what do you think are some of the prospects that could enhance our CV and give it a more holistic look?
Yeah, I mean, again, I think applying to programs that your school has applied to before is huge. So you could potentially, I can't guarantee this, but you could potentially not have any research or very little research, but you get very high marks at your institution and you apply to 5 programs that have always taken someone from your institution in the past every year. There's a very good chance you'll get an interview and get into one of those programs. On the other hand, if you're trying to break into a program that hasn't ever taken someone from your institution or rarely does, then the research publications are more important. The thing I'd say is the more you can make it clear why you did the research, that it's a particular passion of yours and that you really learned something from it. Some of that you can put in your personal statement. I think that helps so that, people don't just think you're shotgunning and trying to get any research you can get from anywhere.
Just one more question on the research since we're talking about it. So it's a very like personal question that how do a program director know whether a research is, again, based on somebody who has 30 publications, let's say, and maybe not that meaningful publications, but on the other hand, if somebody has, let's say, 5 publications and some effective publications, like they do have an impact. So like what would ideally a program director prefer?
Yeah, I don't really know. I think it's different for different programs and different directors. Personally, if I saw you had a lot of research, I would look at your personal statement and your letters to see what they said. If the letters emphasize that the people who know you said you're passionate about the research you've done and you worked very hard and you're diligent and organized, then that would mean a lot. Same thing if you wove it into your personal statement about a vision of why you did the research and what you learned from it. I'd say, okay, this is someone who really worked hard on their research and learned some important lessons and took something away. Someone else who, the research isn't mentioned at all in their letters of recommendation, it's not mentioned in their personal statement, I'd begin to wonder, why do you have 15 publications when no one else seems to be aware of that in your, so those are some of the things I would look at. But unfortunately, it's hard to give you guys hard and fast rules because I think every program, and even within a program, the applications will get split up and different reviewers will read them. And, I've seen this in people applying for cardiology fellowship. 2 of us will review an application. One person will think it's very strong. One person will think it's not as strong. And it just because we each look for different things and have different things we care about. It's hard to predict that for every program.
So Dr. Ryan, suppose that you get 2 CVs, for example, like 2 different CVs, and like one is catered to a specific program. For example, like the research is done in cardiology and they did electives or clinical rotations in cardiology and like just very specific to cardiology. And on the other hand, the other CV has like that guy or has like research in multiple disciplines and they have done electives and rotations and observerships, etc. in like different fields. So like some might be in cardiology, some may be in gastro. So as a program director for say internal medicine, so which CV do you think would you prefer?
Again, it's hard to say because everybody's so different, you know. I think any research, even no matter what field it's in, can be good as long as you show something for it, you know. So, like if your letter writers say you were, I mean, because a lot of what I care about is not what the research is, but what it says about you. So, if your letter writers say you're very organized and passionate, and you're a good writer, you know, and you're good with patients and you're good with the people you work with on the research, that means more to me than the publication itself. This is me personally, you know. So I wouldn't really have a strong feeling one type of publications versus another, more just what does it say about you?
Yeah, so sounds good. Ahmed, do you have any questions, or we can move on to Dr. Jason's book about the gunners?
I think Dr. Jason like pretty clearly told his opinion about the research and everything. So yeah, gunners it is.
Okay, so yeah, so Dr. Ryan, we just want to know, okay, we just want you to basically share your insights on the book Gunners and what was actually the motivation to write that book, because there's just one line that says that every minute not doing Enki is a wasted minute. So now, as a person, like I passed my step one last year, and I'm not an Enki fan. Enki is something that doesn't really help me a lot. So I read that line. Yeah, but I read that line when I was like just a few days before my step one, and I was like, no, did I do something really wrong? So could you just walk us through your motivation, idea, insights, everything about the book?
Well, you know, I've always wanted to write a book. It was one of the from when I was a little kid, I used to read, and I'd say someday I want to write a book. I was always looking for ideas, and I love funny books like The House of God, which maybe some of you have heard of. It's an older book, but it's still relevant today. It's about internship and internal medicine. It's hilarious. And I like other books where the writers are clever and funny. And so, you know, I saw all this craziness going on in medical school, and I thought it would be fun to just exaggerate it to the end of the extremes, you know? So some of my advisees tell me they're dying from doing so much Anki. And I thought, well, what if we had some student who was so obsessed with Anki, they had to do it every single minute of the day in the bathroom and at breakfast, you know, everything. And so that's the story, you know, it's a story of a young woman who comes to medical school. She's the first in her family to graduate from college, let alone go to medical school. So she feels very out of place among all these other bright students. And, you know, she almost fails out because she doesn't know about boards and beyond and Anki and all these things. And so she meets a sort of devious fourth-year student who takes her under his wing and tells her how to become a gunner by doing all the, you know, watching hundreds of hours of videos a day and cramming UWorld questions and not going to any optional school activities. And that's her journey, is trying to rectify her like inner goal to be a good doctor who takes care of patients. But then, you know, her outer goal of trying to succeed in medical school with all these tricks.
Yeah, that's amazing. So like any advices that one could take from your book, The Gunners, for like someone who's preparing, like someone who's navigating through his or her med school, or someone who is preparing for the step one. So any advices one can take?
Well, I mean, it's meant to be a funny book, not like serious advice, but I would say, you know, an underlying theme is the more you forget about the patients, the less happy you'll be. You know, the more you can remind yourself that this is about a service profession. This is about helping others, taking care of sick and needy patients. And that's why we get into it. You can get distracted from that by worrying about your UWorld percentage and your Anki card totals and your evaluations. And I understand that. I did too when I was in school. But, you know, that's always the struggle for the main character, is she's focusing on these achievements to get her ahead in medical school, but then keeps being reminded that, you know, this is a profession about people. And I'd say that's the only thing, like when you're studying for step one, you know, it's important to pass the test. It's important to learn all the things, but just never forget this is about people. And for myself, whenever I remind myself of that, I feel better about medicine, because there's always stressful things in medicine, you know, reimbursements and government rules and all these things. But the more I can remind myself there's people out there that need our help, then usually the happier I am with the job.
Yeah, that's extremely insightful. So now we'll be taking 3 questions from the audience. So it's pre-decided, Dr. Ryan. So I'll ask Filza Khalid, who is a 4th-year medical student as well. Could you please unmute yourself so you can ask the question? I've given you access. Yeah.
Yeah. Hello, can you hear me?
Yes,
Yeah.
hi, Faiza.
Okay, so first of all, Dr. Ryan, your videos have been a huge lifesaver for not just me, but for all of us. So thank you so much for getting us all through med school. Now moving on to my question, I wanted to ask you that based on your years of experience in medical education and teaching, what do you think is a wrong approach towards USMLE Step 1 preparation that you find a lot these days while interacting with the current students, especially now that the USMLE Step 1 has been changed to just pass and fail?
That's a very good question. So when I was studying for the echocardiography boards, the adult cardiology echocardiography boards, I bought this review book and I read through it and I made notes with my pen. And then I took the exam and I passed. And about a month or two later, I found that book in my car. It had fallen under the seat. And I took it out and I opened it. And you have to learn a lot of equations about sound waves and things for the echocardiography boards. I saw this equation and I had circled it and highlighted it. I swear to God, I thought I had never seen it before in my life, even though it had my own pen marks around it and highlighting. And so I like to tell that story to remind people that when you memorize super detailed pieces of information, if you don't use them, you'll forget them within a few weeks or a month.
Mm-hmm.
So I would say one of the biggest mistakes I see are people trying to memorize things months out from the exam. It's not going to stick. You know, you could take the summer off from between first and second year, a year before your step, and go through 10,000 Anki cards. You won't remember any of that stuff the next May. So when you're far out from your exam, that's when you want to learn like big picture principles, you know? What are the general types of antibiotics? What the structures do they target? You know, what are the ways that sepsis presents or heart failure or things like that? Only in that like 4, 6, 8 weeks before the test, that's when things are going to stick. So that's when you can start, if you want to memorize all the DNA viruses versus the RNA viruses or whatever, it might be worth doing. So that would be my biggest piece of advice, is to just remember that this stuff is not going to stick unless you use it. You know, so unless you're going to memorize it and do a practice question on that topic every week for the next year, you're going to forget it. So focus on big picture till you get closer to the test.
Okay, thank you so much. That was highly helpful. I'm sure we're going to keep that in our mind. Okay.
Thank you, Filza. Thank you.
Thank you,
So our
Filza.
next, so Barka, could you please could you please unmute yourself and you can ask the question?
Hello, Dr. Ryan. Am I audible to you?
Yes. Hello. Hi, Barka.
Okay, so I would like to begin by saying that it's a huge honor for me to be able to speak with you today. I am Barka Sajid, a third-year medical student at Jinnah Medical University. And the question I was curious to ask you is, while drafting your book, The White Coat Companion for Step 2, do you consider that there is a need for transforming the current curriculum for the USMLE STEP examinations to align with the ongoing advancements in the medical field? Thank you.
Sure. Yeah. I think it would be great if Step 1 could be redone. I think it's really gotten too big. It has too many topics on it. And I think it's a real bear. And especially since it's the first test you take, you know, it's such a shot to your confidence to find yourself struggling so early in your career. I would love for that test to be redone so that most people pass with 6 weeks of studying. You know, that review, when you think about it, like 6 weeks of studying for really bright people like yourselves who've gone through medical school and passed all your classes, that ought to be enough time to pass the test.
Yeah.
The fact that it's not, to me, says that there's something wrong with the test. It's too big, it's too detailed. So I would love to see them realign that and align it more. The Step 2 test is more reasonable. I mean, it's more clinical. It aligns with things you're actually going to see in the clinic. It's still very broad. I mean, you have to know everything from radiology to obstetrics to surgery. So it's still difficult, but at least it's forcing you to learn things that you'll actually see when you're an attending in some degree. So I have less problem with the Step 2 and Step 3 exams since they do match more what you see clinically.
Makes a lot of sense. So just a follow-up question to that question now, because I'm preparing for step right now. So what would be your piece of advice, like how to basically use White Coat Companion with UWorld and everything? What would you suggest?
Yeah, so Step 2 is interesting because how you prepare depends a lot on how much you were able to see clinically in med school. So for example, if you had a fantastic OBGYN rotation and you saw lots of gyn-onc and lots of deliveries and you did lots of clinic, you probably don't need to watch a lot of videos or read a lot of books. You can just go do UWorld questions or AMBOSS or the Boards and Beyond QBank, and you will recognize the concepts that come up, and you'll get some questions wrong, but then you'll read the answer and it will make sense. On the other hand, if you didn't have a very good pediatrics rotation, for example, or if it's been years or 2 years since you did a rotation in pediatrics, then I think you need some kind of video. The Boards and Beyond videos go hand in hand with the White Coat Companion, so that's a great way to learn. But what I found from students is there's less demand for video learning for step 2 compared to step 1 because you have that clinical teaching. And if it's very good, you probably don't need a lot of videos the way you do. For step 1, there's no clinical exposure for you to base your knowledge base on. It all has to come from books or videos. And so that's why the demand is so high there.
Yeah, makes a lot of sense. That's a good piece of advice for someone who's preparing. Yeah. So our last question would be coming from Ilsa. She's also one of the 4th-year medical students at Jinnah Medical University. Ilsa, could you please unmute yourself and also open the video? Thank you.
Hello, Dr. Ryan. Hello, Karthik. Hello, Bob and Ahmad. Firstly, I would like to thank Team Cardiology Interest Group for giving me the opportunity to ask a question from Dr. Ryan. I am honored is truly an understatement right now. So my question from Dr. Ryan is that considering the broader aspect of a medical career, what qualities, apart from academic knowledge and career, does he want in his students to excel in medicine?
That's a good question. So personally, what I'd like to see in students, especially if I'm evaluating a student or they're applying, is, I like to see a lot of attention to the patient's needs. That's very important to me. So I think a lot of times in medicine, we're all so busy that the patients almost become an afterthought. We're more interested in what was their laboratory results, what did their EKG show, and you forget that there's a real human being behind all those numbers and those tests. So I'd love to see medical students who, really befriend the patients, take a lot of time to get to know them. And when I'm reading an application for someone, like for the medicine residency or cardiology fellowship, those are the kind of things I like to see, either in their personal statement or mentioned about them in their letter of recommendation. Now, like I said, the funny thing is everybody's different, right? I have colleagues who love the technical details. Like they love the applicants who say, I went in the cath lab and I use these 6 catheters. They find that like fantastic, I'm less interested in that. I'm more interested in what was the patient's experience like when you were in the cath lab, how did you see them going through it? So anyway, this is, everybody's got their own biases, but for me personally, I love seeing the type of doctor who doesn't forget about the patient's needs, and shows evidence of that when they're spending time with me in the hospital or in the clinic.
Yeah, I think that's the real insight into the field of medicine. So that's just a question to that as well. That how do you actually, because you have years of medical education experience and you have interacted with so many medical students, so many residents and fellows. So a question that what differences do you see between international medical graduates and American medical graduates in terms of patient interaction, in terms of knowledge, in terms of skills?
Yeah. I don't see much difference in terms of knowledge and skills. I think international medical graduates perform just as well as American medical graduates. The biggest barrier for some international medical graduates, I don't think this gets talked about a lot, but it's accent and understandability. There are some international medical graduates who are hard to understand for me or for the patients. And I think this doesn't always get said directly, unfortunately, but it can affect their evaluations and things like that. So, I would say if you're years away from applying and you want to go to the US, just make sure you work on those English skills. You don't have to have a perfect English accent by any means, but you just have to be clearly understandable. That makes a big difference, I think, when you're rotating in US hospitals. Especially, I've known some IMGs who go out to these hospitals, they're out in the middle of nowhere in rural America, and if you're hard to understand, it can be a real impediment with the patient. So that's something I would not forget to work on. All you guys are completely understandable today, by the way, so I don't see any issues there.
So Doctor, now that we're on the topic, so there's this increasing debate that's been going around that for IMGs to successfully match, they have to get step 3. So what's your opinion on that? Like on step 3?
I don't know much about that. The applicants I've seen for medicine residencies have not taken step 3. They take it in residency. I guess it depends on when you graduated. I mean, the IMG residence applicants can be very different. Some of them are like American students, they're 4th year, they're applying straight from medical school. Others have been out for 1, 2, or sometimes more years, and they're trying to apply. So I think if you've been out for a while, it probably makes sense to take step 3, but I don't actually know a lot about how program directors are interpreting that.
Okay.
That makes sense. Do you guys have any more questions, or we can just kind of conclude this session with one last question? So any questions that Ahmed and Rabab, if you have?
No.
I think I've asked plenty. Got a pretty insight from Dr. Sometimes the guy himself.
The best thing I could say to you guys is to hang in there. I know the path is harder for IMGs than UMGs, but you know, I work with so many great IMGs as attendings. I've worked with them as fellows, as residents. So there's a real need in the United States. You know, we don't have enough medical school graduates to fill the positions. There are lots of specialties where there aren't enough doctors around and patients don't have enough access. So we really need you guys. So I really hope you all hang in there. And even though it's a difficult journey, just stick with it.
It is.
Thank you so much, Dr. And so just one last question before we conclude this session. So now in this already challenging and exhausting journey of medical school, like medical school is so much of a roller coaster. There are highs, there are lows. So what should one look up to, or what should be a person's vision or goal so that they can motivate themselves even at the lowest point in their med school? Like any piece of advice, any general 4 pieces of advice, let's say, for medical students, all of the medical students out there.
Yeah, there's a couple of things I could tell you. I mean, you've probably seen me post about this on Twitter, but as much as possible, try to ignore your classmates. You know, you don't want to be worried about what everyone else is doing. It will only stress you out. No one's yeah, I mean, of course you have to talk to your classmates and be friends with them, but don't worry about where everyone is in terms of their grades or their UWorld percentages. First of all, a lot of people aren't completely truthful about that. So if they tell you how well they're doing, most of us don't like to reveal the things we're doing poorly in. We only tell the good stuff. And then the more you go down that rabbit hole of what is everyone else doing, what am I doing, the more stressed out you'll be. You know, make your own plan, stick with it, put your head down and do your work, and try not to worry about what everyone else is doing. The other thing is it's really important to have outside of medicine interests, whatever those may be. You know, I used to play basketball in medical school, go to the gym, people play guitar. You know, those things are going to carry you through your whole career. I mean, because it's not like medicine suddenly gets easy when you become an attending. Even though you're not being graded, it's still very stressful and it can be all consuming. So figure out what you like to do. It could be gardening, it could be hiking, it could be your dog, but you know, you need to take time for those things regularly throughout all of your training, and now is the perfect time to start.
Yeah, so that's real piece of advice that all of us can take and then literally survive through our med school. Dr. Ryan, this has been an absolute honor. I literally cannot tell how like I'm literally fanboying since the start of this session. So it's extremely honor for all of us to just host you. We'll be taking a screenshot of this screen, so all of you guys can just look so that we can post it on later. I'll be taking a screenshot.
So, like, do you have to pose with thumbs up or?
No, that's okay. That's okay.
It's my pleasure. I mean, I can't say this enough. I cannot believe we live in a time when I'm in my office in Connecticut and I'm talking to people in Pakistan who know who I am and are happy to meet me. I mean, this is an amazing age we live in. It's easy to get down about things around the world, but this is a really cool age we live in that we can connect like this. I love it. It makes my day.
I'll just share that when you just replied me back like, hello, Karthik. I was literally off flat. I mean, how can Dr. Jason Ryan just take my name? I was literally like,
like when Karthik told us, I thought he was bluffing. I think he was just making things up that Dr. Ryan is like, yeah, sure. Dr. Ryan, the BNB guy, sure.
No, these things are fun. I mean, I know you guys watch the videos, but I never get to interact with you. So as long as I have the time, I'm always happy to do these things. It's a blast for me too, to meet all of you.
Yeah, all of us are really, all of us are really, we're really excited when this thing was announced. And just a fun fact that when we introduced the Google Forms, like for the people who can attend this session, we got 100+ responses in just less than 6.5 minutes. So you could just tell how crazy everybody is for you, just to listen to you, just to get your insights and everything. So extremely thankful on behalf of the entire Jinnah Sindh Medical University, Karachi, Pakistan, to host you. This has been an absolute honor. Hoping to maybe meet you, interact with you live very soon in the US, maybe when we get into the residency and come to the US.
Yeah.
I mean,
if you get to the US, let me know.
One day.
One day, yeah. Maybe
We
one day.
definitely will,
Perfect.
sir.
We will.
I was in Dubai in January. That was my first time to the Middle East. So maybe someday I'll come to somewhere in Pakistan. I'll let you know if I do.
We would love
Yes,
to
sir, we were
host you.
looking
We would
forward to
love
that.
to host you. That would be crazy.
It would be a
Thank you
treat.
so much, Dr. Ryan. Thank you.
Thank you so much, Dr. Ryan.
All right. Thank you very much, everyone.
Take
Have a
care.
great day. Good luck with everything, okay?
Same. Have a great day. Thank you.
Bye-bye.
Bye. Take care. Thank you, everybody, for joining. Thank you. Have a great night.
Thank you, guys.
Thank you.